Some breast cancer patients require treatment in addition to surgery. I'm here today with oncologist Samir Alsawa to talk about the medical oncology treatments available. Dr. Alsawa, can you tell us about some of those treatments?
Sure. In the past used to be simple chemotherapy and that's about it. Over the years it's changed dramatically to systemic chemotherapy, hormone therapy, and more recently exciting immune therapy, which utilizes the immune system of the body to fight its own cancer. Very exciting.
How do you know if a patient would receive benefit from chemotherapy?
Well, chemotherapy in the past used to be used for patients with advanced cancer. Gradually and slowly we start using it in early stage cancers. So roughly most patients with like stage 1 where the cancer is a little bit more advanced than a very early stage, will give them the benefit of chemotherapy if we believe that there are reason to worry about potential cancer cells having spread somewhere, or sometime even if the cancer is too large for the surgeon to operate, we actually nowadays give chemotherapy ahead of surgery before the surgeon even remove the cancer.
Oftentimes when you hear about cancer treatment, people will ask about clinical trials. What are they and how do they benefit a patient?
Clearly, where we got to where we are today, we had to pass through phases where we can try different drugs on different combination of drugs. So sometimes clinical trials isn't what patients believe or families think that is simply a totally experimental or being a guinea pig. Occasionally would be a combination of two drugs that are well approved for treatment, but putting them together sometimes might be more beneficial. So using different combination, different dosages, adding to them some new very promising trials after they've been proven to be safe in early phases of clinical trials. So I think clinical trials is very, very good option for patients.
Wonderful. And so you talked a little bit about the advances in chemotherapy. What's most important to you when it comes to those advances?
I mean, it's what we've seen in the past 15, 20 years is a big change in the outcome of patients. And so basically we can nowadays treat patients with very aggressive treatments and they'll maintaining their quality of life, keep working, enjoying their quality of life with their families, and also the survival benefits. So most patients nowadays will actually outlive the cancer.
Wonderful. Well, you've provided us with some great information. Is there any closing thoughts that you might have?
Again, we still keep reminding patients all the time, screening, diagnosing cancer at early stage is offer the patient the best chance for being cured. So self-breast examination, mammograms, make sure you visit your doctor at least once a year, do a breast examination by a medical professional, whoever that would be, that would still be your best option.
Wonderful. Thank you for sharing that great information with our audience.
Thank you for having me.
I'm Lynn Griefor, reporting from McLaren Port Huron's Today's Health program.